Breast augmentation is an operation that we do as an outpatient to enhance the appearance of a woman's breast. Augmentation means we're enhancing, we're enlarging, we're making them bigger. And it's really one of the most popular operations we do today. And I think the popularity has increased as a result of the fact that silicone implants have now come back on the market. We usually do this as an outpatient. The procedure takes maybe an hour and a half. We usually do it under IV sedation, so the patient really feels no pain. I sort of tell people you're in la-la land. You're back there, we have an IV, we give you some medication. And many times people wake up and say, when are you going to start? And I say, your operation's over. There basically are three types of incisions that are utilized in breast augmentation. The first incision is the axillary incision, which I don't subscribe to. The second one is what we call a periareolar incision. The nipoareolar complex has a certain size, and then we make an incision, sort of a semicircle along the inferior portion of the areolar complex. And the third, and the one that I use 99% of the time, is the inframammary incision, which I think is the best. And by the way, has been shown to have the lowest incidence of marked encapsulation. So it's the incision I prefer most of all. Basically, there are two types of implants, general categories it is. The first implant is saline, which is a silastic shell, and inside of that shell is saline or salt water. The second one is the silicone gel implant. The new silicone gel implant, somebody utilized the term gummy bear. And when I compare the implants today from what we used 30 years ago, there's a tremendous difference. If I were to take a silicone implant today and cut it in half, you have two pieces. And that's where the gummy bear came in. Like if you took a gummy bear and cut it in half, you got two pieces. Come back 6 months later, two pieces. Silicone implants, in my experience, give a softer, more natural appearance and feel to the breast. I think that many patients that do have saline, especially if they have very little breast tissue, will feel the rippling of the saline, and it's not a natural feel. So I basically tell patients, the less breast tissue you have, the more important silicone becomes. Many times women will have had saline implants, they come in for an exchange, and one of the things they don't like about saline is there's rippling, waviness, unevenness, and you can actually sometimes palpate the saline implant through the thin tissue.